you, everybody, as always, for listening to us. We appreciate you. Over how many years has it been, Michelle?
I think 17 or 18 now.
17 or 18 years, so it's been awesome. And we have Karina as our newest member. The last year or so, Karina has definitely become a fixture as part of our show. And the reason that I love having Karina here is because she is not only our surgical liaison. What else do you do at the office?
Medical assistant and scrub tech. So.
And scrub tech, right? You're just supposed to say you take care of me.
And that.
And that, yeah. So she takes care of me, and so it makes my life a lot easier. So thank you, Karina, for being here.
Thank you.
So Karina, today, we were going to talk about certain things, and as a lead-in, as would always, when Michelle or Jeff in the future is going to be contacting us, like, what is the show going to be about? I kind of turned to you and said, what do our patients seem to be thinking about when they come in? Today, not surgery, but medical treatments,
yes.
cosmetic treatments. What are they thinking about when they come in? What seems to be the most frequent concern?
That's a very good question. I think we're all feeling and looking tired. I for sure feel tired and look it, so.
Wait a minute, you're a lot younger than me. You cannot feel tired.
Oh, yes, I am.
Okay, so you're chasing after me. I know, so that kicks the tire on anyway. So when they see when patients come in and they say that they are looking tired, and by the way, I love when they come in as opposed to them coming in and saying, Dr. Tom, Karina, I'm concerned about this one wrinkle.
Right.
Okay, I love it when they kind of come in and they just kind of give you a feeling as to what is their concern, so that we're not just honing in on one little aspect of the face. But then we eventually get to that point where somebody says, I'm feeling tired or I'm looking tired. What kind of areas of concern are the patients?
Yeah, so definitely they're noticing the hollowing under the eyes, or there's eye bags that they're saying, look at this, makes me look tired or not approachable. So, yeah.
And it's interesting, what age groups do you think are primarily those that are coming in to see us for that concern?
I think it's all across the board. I do think that the tired look, if you didn't sleep well, you look tired. So I think it's not, I don't see a specific.
You don't see an age specific,
yeah.
right? And so one thing you did say was, if you didn't sleep well, you look tired. I think the subset that's coming to see us, Karina, are the ones who aren't tired, but they look tired. And just like the person who says, I'm not angry, I'm happy, but everyone thinks that I'm angry or I'm upset. And so it would be the ones who aren't tired, but they feel like that's the persona that they give off. And there's definitely a phenomena in clinical psychology that's called the mirror phenomena. And so what we emote out to the world kind of gets reflected back to us. And I always use the example of two cashier registers, and you're in line whatever you're buying, and one person there is smiling and yakking away with everyone, and the other one is scowling and doesn't look very happy. Which line do you gravitate to? You gravitate to
the person that's smiling.
Of course, exactly. And it's the same thing with that energy level of not looking tired. So you mentioned under the eyes and the hollow of their eyes, and as I had referred earlier in the show, that I like it when they come in and they just give us an idea as to what is their concern. It allows you and I to evaluate them and to help to hopefully remedy their concern and make them feel better about it versus just a specific wrinkle. So one of the things is looking tired in the eyes. So actually what I would first recommend, believe it or not, before we would go to that area just under the eyes, is trying to relieve some of the hooding that occurs above that area. So that would be our brows, okay? And so one of the simplest things that you can do is use Botox, or the other Botox that we use called Dysport, is to treat the area, the frown area, or the 11s in between the eye. And by treating that area, that actually lifts up the brow on the outside. And for women, they especially like that because it gives them an arched brow. Do you remember, like, your grandmothers or anybody like painting their eyebrows and giving it an arch? Did you have that experience?
No, my family we're all Latinas. So we have lots of very bushy, hairy eyebrows. I do remember them plucking, though. It was that very thin eyebrow look.
Okay, so when they plucked their eyebrows, did they make them straight across, or did they make them more at an angle?
Definitely that very thin, kind of rounded kind of
exactly.
eyebrow look.
Right, so there was an arch versus Frida Kahlo, I think
Yes.
her eyebrows were straight across,
Yes.
right? Okay, so we kind of evolved to where women like that eyebrow that's arched, and actually even look back in the Egyptian time, look at Nefertiti, you know, and even some of the, you know, the female, you know, on the pyramids and so forth, as their eyebrows are arched. So that's a feminine look, and so that can actually be very effective with Botox or Dysport, treating the frown area between the eyes, that actually lifts up the outer part of the eyes. Now, how about for guys, you know, for us guys, we do alter the way that we treat that, because we don't want them arch too much unless the person wants that, but we want to kind of keep that masculine look. So lifting up the upper eyebrows kind of opens up the shades, if you will, you know, that you drop down on the window, and allows the light to come in. And so immediately by doing that, you get more light reflecting on the eye, because a lot of times people, when they say their eyes look tired, they're just not as sparkly.
Right.
Okay, so, you know, we want everyone to have a sparkly day.
Twinkle
right?
in their eye.
We want the twinkle in the eye, exactly. So I'm doing the Botox there in between. Any other areas that we can treat with Botox that would help to open up the eyes?
Yes, of course, my favorite.
Your favorite? What is your
sides of
favorite?
the eyes.
The sides of your eyes, okay.
Yes.
So you're a Gen Zer, or our beautiful Gen Zer Latinx, okay. And so the sides of the eyes, I like this. I want to see how much you've been listening when I talk to the patient.
Oh, okay.
So why do you like treating the sides of your eyes? Do you have many crow's feet there?
I don't really think so.
Okay.
I don't pay attention too hard.
Okay.
But I definitely do like the awake look it gives me, the opening of the eyes. Even for being Latina, I do feel like my eyes are a little bit more of the Asian kind of look.
Okay.
I know.
Right.
Yeah. No, that's great. You do want to look like you're awake and engaged when you're talking with somebody. Right. So having your eyes look a little bit more open and bright, it's perfect.
Yeah,
yes.
I absolutely agree. And so Karina has actually been listening to me talking even to our young staff members, especially if they're in their 20s and they're interested in maybe trying Botox or Dysport for the first time. And a lot of times they think I'm going to want to recommend treating the frown area.
Right.
And actually, especially for these young ladies, I tell them, let's treat the side of your eyes, because it actually opens up your eyes more. And after we do that, they're hooked, because they go, oh my God, what a difference it makes. And they didn't realize it. So that makes them look less tired. Okay, so we kind of pull up the blinds, right? Pull up the shades, blinds, and let the light in. So that's number one. Another thing that we can do to help to let the light in is actually to fill in the temple area. So Michelle just mentioned that October is her favorite month because of Halloween, and of course, you know, the Dia de Muerte, right?
Yes.
What are the kind of the more popular Halloween signs or characters that we see?
We see the skulls.
The skulls, right?
Skeletor.
Right, Skeletor. And so I've had patients come in, ladies come in, and men, but especially ladies come in and say, you know, I feel like I'm looking like Skeletor, because their temple area is hollowed, especially if they're real slender.
Right.
And so because of that hollowing, it does allow your brow to drop down as well. So by filling it with either fillers, hyaluronic gels like Restylane and Juvederms, we also have Renuva, which is our cadaver fat, which stimulates our own fat growth. We can inject it in that area. And then also a collagen building treatment that we call Sculptra, we can inject in that temple area. And that kind of helps to lift up the eyebrow, okay? And actually for me, so I think I'm Mexican, but I really am Chinese and Greek. So for me, I actually want Mary, our lead nurse, to inject the Renuva or the cadaver fat in my temple areas, because I need everything I can, being a baby boomer Asian-like face, to help to open up my eyes as much as possible so I don't look sleepy. So again, that's kind of lifting up that area.
Right.
Okay. So now we got to get down to the under the eye that you mentioned, Karina. So what kind of treatments would you recommend for patients?
Yes, we definitely, for our favorite, most recent treatment, I think it's been 2 years, right? Roughly around? Yeah, the Easy PRF gel.
Easy PRF gel. So
yes.
What is Easy PRF gel?
Easy PRF gel is is your own body. So we're using your own blood to spin in a centrifuge.
Right.
And we're using your PRF, your platelet-rich fibrin.
Perfect.
But it kind of goes through a process where we turn it into a gel-like
substance. So again, I guess we got the Halloween theme going here. And so you're being a vampire and you're drawing off somebody's blood.
Right.
And then you're going to be putting on your Einstein-like costume, okay? So you're the mad scientist, and you have 2 vials of blood from the patient, and you're spinning it down. So one, we then put on a cooling system, and that's our
PRF.
Our PRF, our platelet-rich fibrin. So I'm going to backtrack for a minute. So we used to talk about PRP, which is platelet-rich plasma, and it was really nice for rejuvenating the skin to help it to be healthier. It's a very small layer of our serum, of our blood, that contains platelets. That's why it's called platelet-rich plasma, or PRP. But it has healing factors. It's not a stem cell transplant, but it does stimulate our own biology along those lines, along that stem cell line, okay? And so we would use it and the skin would look better, but for me, I was a little disappointed in treating the under eye area, or was hollowed out, Karina, because I didn't feel like I got much of a volume effect,
Right.
okay? So then we went on and then the industry developed the PRF, which is the PRP activated. And again, what does that PRF stand for?
Platelet-rich fibrin.
Platelet-rich fibrin. So the word fibrin, like collagen, right? And so we started to use PRF and injecting it under the eyes as well. And that seemed to be better than the PRP. The skin looked better than the PRP. In terms of volume effect there, I could see a difference with my cosmetic surgery eye. I'm not sure for the patient who's paying for this service, that it was enough bang for their dollars, bang for their buck. So we didn't do a lot of just plain PRF under the eyes, did we?
Not much that
No,
I saw.
right.
I think our nurse Mary liked it more.
Yeah,
she
Mary
did a
seemed
lot
to
more.
like that more. It may have been a subset. And maybe Mary, being a nurse, was looking at more of the nuances in her subset of patients, and me being a surgeon, if one's good, then 100's better, right? And I wanted more results, so that PRF was nice, but again, I didn't push it real hard. Then along came PRF gel. So we talked about drawing off the blood, and the platelet-rich fibrin is PRP activated. What do we do with that other test tube? Because now we've drawn two test tubes of blood for this, and you're the mad scientist. What are you doing?
So that tube is actually it's turned into gel by warming it. So we put it in there's a little incubator that we stick it in there. It's set at 99 degrees, so it's pretty warm.
Okay.
And then we set it for 12 minutes, and usually it takes anywhere from 10 to 12 minutes to get to its solid form.
So if you want to see what Karina looks like, go on to YouTube under Dr. Walter Tom, and you can watch the show here, and so you can imagine her being the mad scientist. No way does she look like that, but she looks like she could, gray hair, all ratted up. I'm going to have to get you a wig, an Einstein wig, and you are the mad scientist doing that. So you're warming up the second tube to get the gel. And what we're doing for our listeners is we're actually trying to pull out your own protein called albumin. And so this is where we always segue over to Michelle. What is albumin?
It's like the egg white.
There you go. Excellent. Thank you, Michelle. So it's like the egg whites, and so it has that gel consistency. And so then what do we do? So I'm getting ready for the patient. I'm yakking. I'm just socializing with them, and you're finally bugging me, kicking me and say, hey, you got to do the treatment. So we're ready to do the injection. What do you do with these 2 tubes of PRF and your albumin protein, the PRF gel?
Yeah, so the 2 syringes, one is going to be still liquid, so the PRF is cooled. We keep it cool so it's not activated.
Okay.
And the gel consistency, we want to mix together.
Okay.
And then after that, we want to get fairly quickly to injecting. Dr. Tom needs to, that way it doesn't
I need to
start
quit
clotting.
talking and start injecting. Okay. So because it clots off. Remember, platelet-rich fibrin. So platelets are important for our clotting system. Sort of very much like I always use the example when we're little banshees running around and we scrape our knee and we get a scab on our knee, and then we continue to run around because we're crazy little banshees, and then the scab comes off, you see this clear yellow fluid come up. That's our PRF.
Right.
And that's actually our platelets coming in there to help to clot off that area so we don't continue to bleed from our knees. Okay, so we mix it up and we have this gel-like consistency. And so what do we do? How do I inject it? how would you share this
so
to
the kit
to our
comes
listeners?
the kit comes with its own syringes, and there's usually there's 5 1 ml syringes. Generally you get anywhere from 4 to maybe 5 mLs depending on the patient.
So they have to drink a lot of
they
fluid,
have to
right?
drink a lot of water,
Right, because
yes.
if you're dehydrated, you're not going to get as much
Yes,
serum. So
yes.
got to drink a lot of water before you come
Yeah,
in.
yeah.
Okay.
So definitely not, oh, I had a cup of water this morning. We need
Right.
Lots of hydration.
Okay.
And then I can tell when the patient is dehydrated. I can definitely see the amount of that comes out and the quality. So
All right.
you can say you drink water, but we'll know.
Uh-oh. You going the Karina stink eye? Is it what happens
We
there?
will know.
I've seen that stink eye. Hopefully our patients have it. Karina, I need to talk to you. Okay.
I just ask you, are you sure you had enough water?
Okay, so we draw that up, we mix it together,
Yes.
and so then I freeze up the skin with a little local anesthetic, and then we take a long tube, it looks like a long needle, but it's actually blunt at the end, and then we put it on, and I go underneath the eye, and I inject it underneath the eye, and what that does is help to plump up that area and help to relieve you of that under eye
Right.
hollow. The way that I've described this in other shows, looking at the eyes like a window, Karina, is that what we're doing is reestablishing the undersill, the window sill, the window seal, which is underneath,
Right.
okay? And so think about a window seal, and when the light hits that window seal, what happens? It bounces up into the window, right? So that's what we're doing, and it's amazing by just adding some volume in that area with the Easy PRF gel, that makes the eyes definitely brighter and makes you look more vibrant and less tired, for sure, right? So we do use that, and it's interesting, and that's probably you, because you like you like the finish work, Karina. You went right to the finish work. I would say, working on that window seal would be the finish work, but what I'm also looking at is the foundation or the wall, because the window frame has to sit in the wall, right? So a big part of what we do to help with the under eyes is the cheek area, okay? And so we can inject that cheek area just under the eye, and we can use fillers such as the Restylans and the Juvederms, okay? We can use Sculptra. We also can use Renuva, which is our cadaver fat, which can actually stimulate our own fat production. So it's part of our biostimulatory series of treatments, and we can inject it under there. And recently I have been using that Renuva not only to put in the cheek area proper, but I'm actually putting it directly under the eye in the area that we inject the Easy PRF gel. And I have to say that I'm liking the results. So it's a combination of the Easy PRF gel stimulating your own collagen and improving the skin, the wrinkling of the skin in that area, and then adding something with a little more substance. Remember that surgeon, me versus Mary, right? Our lead nurse, is that I want more of that kind of that structural volume using the cadaver fat or Renuva and injecting it, and that's Renuva, Renuva, and injecting it a little bit under the eye, and I like the results. Karina, we carry the Abaji line in our office. It's a very well-known cosmetic hyperpigmentation line with Dr. Abaji, and his daughter, Dr. Susanna Abaji, is actually the chief of dermatologic medicine at University of Pittsburgh, and she was moderating at a conference in New Orleans when I was presenting this work for the American Academy of Cosmetic Surgery, and I remember her being very complimentary of the talk, and she specifically asked me about using the Renuva specifically under the eye. And so because of that kind of challenge on her part, I told her that that this was a newer technology. I kind of wanted to gain more experience in the general areas of more structural support like the cheek, but then I was going to start to branch out and to dilute it a little bit more and put it in more delicate areas like under the eye. And so it just so happens that she's actually going to be our featured speaker at the California Academy of Cosmetic Surgery meeting in San Diego, that you're going to be joining us on right around Halloween, down in San Diego. And so we're going to be presenting together, and so I'm going to be very much interested in presenting our new series of patients for her to comment on. So we are using that Renuva under the eyes as well to add support to the under eye area, and then kind of finishing it off, as you had mentioned, with the the window seal treatment of the Easy PRF gel. Okay. All right, so we're doing that. How do we, with the Renuva, Karina, what do we do with that? How is it, what can the patient expect, and what are you doing to help us to deliver this treatment?
So the Renuva, it comes in a sterile packaging. It comes in a 1/2 ml or cc syringe.
Okay.
And we are also diluting it with a little bit of lidocaine to help with the comfort of the injection.
Right. Always want to make it comfortable for the patient.
And a little bit of saline. And we do it in a sterile manner for the patient. So
we do.
Yes, we do.
Yeah, it's interesting that sometimes I'll be on social media, on Instagram, and I'll see some other providers doing that, and they just use a clean technique. And again, that may be just from my surgical history as a transplant surgeon, general surgeon, as well as a cosmetic surgeon, of really using sterile techniques for this. So we prepare the fat, and so you add saline, a little saline and a little lidocaine to that area, and then how do we inject that fat?
It would be the same technique as you would do for the Easy Gel or your fillers with the cannula for that area. You do add a lot of numbing actually for the patient prior. So obviously the numbing is in the Renuva when you mix it, but we try to make it as comfortable as possible.
Yeah, I've always said that I'm the president of the Weenie Club, but I'm an empathetic weenie, so I want to make it comfortable for the patient. So we do take some lidocaine, some local anesthetic, and we do inject it into whatever area that we're treating. Whether we're treating the temple area or the cheeks or under the eye. I do add a little bit of local, but I do have to let the patients know they're going to be swollen for a little bit, but that will get all reabsorbed. Yeah. And Michelle has a question.
I do have a question. With the PRF, treatment, does it help at all with the coloring underneath the eyes? Because some people have very dark coloring underneath their eyes.
What do you think, Karina?
I'm actually not really sure if we've had patients who have that much pigmentation and who've said, oh, I've noticed a big change, but I definitely think it made the quality of their skin better. And
definitely it makes the quality of skin better, and I guess those patients must be talking Chinese to me because Karina hasn't heard that from them, but it's actually a pretty common concern. They'll talk about the dark circles under the eyes, okay? I've even heard of handsome young guys who say, I have raccoon eyes, okay? And they want that area treated. So adding volume to that area absolutely helps with that darkness. Now, if the darkness under your eyes is related to pigmentation changes, we talked about Abaji skincare, that's something that we would recommend, and that will help to minimize the pigmentation there. Karina, we're always recommending sunblock, right?
Yeah, sunblock. The ladies, we're kind of lucky because we can just use concealer.
Right.
Okay, all right. So concealer or sunblock under our eyes is important so we don't get recurring hyperpigmentation. And then if it's related to a thinning of the skin, a thinning of the tissues or fat under our eyes, what happens is we begin to see the blood vessels underneath there, or the blue blood vessels. And so sometimes what we perceive as darkness is more of a bluish hue under our eyes. And so using the Easy PRF gel as well as the Renuva, the fat or fillers, can make a big difference for patients. So, we're talking about medical treatments. If we were talking more surgical, we would talk about surgical facial fat grafting, which I love doing, but we're talking about simple things that you do, you're awake, we take care of it, and you leave, and you're doing great, and you carry on with your day. So it definitely can help. Also, if you have hyperpigmentation under that area, which is more of the brown spots or the sun damage, we can recommend our BBL or our broadband light or our photofacials to treat that area. Michelle, we're going way back to photofacials. You and I talked about that how many years ago?
17, 18 years
18 years ago we talked about that, and it's still a great treatment for hyperpigmentation. So that's what we would do. So overall, I think that you've done a great job. Thank you, Karina, of helping us to kind of describing how we can help people who look tired. Number one, we want to unroof, the brow, little Botox Dysport, maybe some filler under the brow and the temple area. And then we want to fix, you went right to the windowsill. So we talk about Easy PRF gel, which helps to improve the texture of the skin, helps with some of the discoloration we see or the darkening in that area, and a little bit of volume. But then me being the surgeon, I want more oomph, and so we're adding Renuva or fillers in the cheek area, which helps to support the window seal in terms of treating that area. So that's it, and I really appreciate it, and we're going to turn it back over to Michelle.
Thanks so much, Dr.
Thank
Tom
you.
and Karina. Yes, if you are looking in the mirror and, oh my goodness, scary, you want a little bit of help, get a free consultation. That's really the best way to start, by reaching out to Dr. Tom. You can call him at 707-542-8346. 707-542-8346. You can also check out different information online at drtomcosmetic.com, and there you can look at before and after pictures, which are great, and see all the different kinds of procedures. But again, reaching out and talking with Dr. Tom, talking with all the great talented people there like Karina, and just really figuring out what is the best path for you. We're all individuals. Dr. Tom has offices in Santa Rosa, Napa, and Maui. And again, online at drtomcosmetic.com. We will see you next week.